Welcome to this, our second Fuse Physical Activity Group pop-up workshop. You should have heard the message there to say that these presentations have been recorded, so just so you're aware of that. And we're only recording the presentations. We will stop recording before the Q&A session. So it's a great pleasure to welcome today Professor Peymané Adab from the University of Birmingham. She's Professor of Chronic Disease and Epidemiology and Public Health at Birmingham. She's well known for national and international work in the prevention of chronic disease, particularly in children and in minority ethnic groups. So we're really looking forward to hearing her talk about an evaluation she's been involved with of the clinical and cost effectiveness of the Daily Mile, not the Daily Mail, thank goodness, the Daily Mile in reducing obesity in children. And after Peymané's spoken, we've got two presentations on experience from people who've been involved in implementing the Daily Mile in schools. So first we've got Michael Harkins from Chandlers Ridge Academy in Middlesbrough, and then David Turnbull from Northumberland County Council. So they'll tell us a bit about their experience of putting it into practice in the real world sort of thing. I'm just trying to make my slide move down, which it won't, just a sec, bear with me. So with this, we're in the first bit, the introduction and housekeeping bit. I've already told you about the programme coming up. So we'll have the three speakers, then there's an opportunity to have questions or have a Q&A session after all three speakers have spoken. We'll have a quick 5-minute break just to grab a cup of coffee and then come back and have a bit more of an informal discussion around physical activity and young people. Just before we get going, with a few rules just to make the afternoon run smoothly. Please ensure your microphone's muted and remain so, unless you're asking a question when you're invited to speak. Do stop your video just to help us with the streaming quality, but nice to put them on when we come back after for the coffee break, because it's quite nice to have a bit more interaction then. If you've got questions during the presentation, please type them up into the chat box in Zoom, and we'll make sure they get to the speakers at the end when we do the Q&A session. In the social, if you want to speak, just put a question mark in the chat box, or you can use the raise your hand function and we'll unmute you so you can ask your question. If you think someone's being inappropriate in any way, let Laura Ritson know, and she's got the power to boot them out. And just be professional. I think we've all gotten very used to working in this way now anyway. Oh, that's coming up next. That's it for now. So I'm just checking with Peymané. She's had a little bit of difficulty with her getting into this meeting, so I may have to share her slides with you rather than, is that still the case, Peymané?
Actually, so I'm going to have a go at the screen and hopefully.
Great. I'll stop sharing and let you try then, Peymané.
Thank you. Okay. So my apologies, just had a bit of a panic trying to get this sorted, but I think we have now. So I'm going to have a go at sharing the screen. So thank you very much for inviting me to come and talk about the Daily Mile evaluation, which we completed and published about a year ago now. I'm going to just very briefly talk about what the Daily Mile is. I'm sure most of you will be familiar, but just go over what it comprises, why it was important we thought to do the evaluation, and then tell you the results of the evaluation that we did, and then hopefully we can then move on to discussing the findings later as well. Whoops. So for anybody who doesn't know, the Daily Mile started as an initiative in a school in Scotland when the headmistress at the school had noted that children were getting increasingly unfit, and this was affecting their performance in school. So she started this initiative of getting children to do some activity every day, the Daily Mile. And having started that, one of the things that the school went on to report was how much, in addition to getting children to be more fit, it had effects on children's well-being, better social interaction between themselves and with teachers, improved their concentration levels, and also reporting that no child in the school was obese after a bit of time with the programme having been sort of initiated. So this is quite a claim, and first of all, I just wanted to have a look at what are the theoretical pathways through which such effects might have been realised, really. So what is the Daily Mile? It's a programme where children in primary schools at the moment mainly are encouraged or sort of asked to go out every day, outside every day, whilst they're in school, and that during that time they have 15 minutes where they walk or run as fast as they can around a sort of perimeter, as a path around the school grounds. And so through this habitual activity, in theory, that should result in habit formation that may become a permanent behaviour change. There are other features such as children being allowed to set their own pace. So it's not a competitive activity against other people, but children will use themselves as the bar, so they have autonomy, and that is a motivating factor to improve their own pace and their own fitness. So that's also a potential mechanism for changing behaviour. In addition, teachers have some autonomy in terms of choosing when and how children can go out and do physical activity as well. So again, a motivator for change. It's an activity that all pupils take part in, so it's inclusive and could promote social norms. And although it doesn't look like it in this picture, the children are not asked to change clothes into PE clothes. They can go out in their school uniform. And so it's a relatively simple activity where they could just go out in whatever they're wearing and spend 15 minutes in activity, which would promote capability and competence. Potentially there is no cost, so that's one of the arguments, although one could argue that it does reduce class time for over an hour a week if children do this every day. So potentially there are impacts on other things like academic performance that need to be taken account of. So why did we decide to evaluate this? Once the school had publicised and got people to know about the effects of the programme, the government, lots of schools have started to do similar activities, and the government took notice. So in the Childhood Obesity Plan that was published in June 2018, the UK government announced measures to halve childhood obesity rates by 2030, and within that plan, one of the strands was involving schools, and in particular, one of the components was that they endorsed the programme or programmes like the Daily Mile, saying that they promote a national ambition for every primary school to adopt an activity such as the Daily Mile. So here we have a programme that's been had some positive effects in one school, and it's being endorsed as something that schools should take up to reduce childhood obesity. Obviously, that's important. We know that childhood overweight and obesity is an increasing problem in the UK, and primary school children are a prime target for prevention. So from the National Child Measurement Programme, we have lots of evidence now that obesity rates double from school entry until children leave school in year 6. So obesity rates go from about 10% to 20% over that period, and severe obesity also increases. And we also know that the primary school years are a period when inequalities emerge in health, So in particular, we know that the deprivation is one of the main drivers of obesity in children, and that inequality has been increasing. So this is data from the most recent NCMP showing the change in prevalence of obesity in boys who are 10 to 11 years old, over a 10-year period from 2009 to 2018-19. And you can see that the prevalence has been increasing in the most deprived populations, whereas it's been decreasing in the least deprived. So this gap in inequalities has been growing over time. So if we can address childhood obesity during the primary school years, we can impact on the longer term health of children. Obviously, physical activity is one of the drivers for obesity. And again, we have plenty of evidence that children don't take part in sufficient amounts of physical activity. So the most recent data from Sport England suggests that only 18% of children are following the guidelines of 60 minutes of physical activity every day. And there are inequalities in physical activity as well. So girls are less active than boys, and the people who are in lower income families, less affluent families, children are less active than those who are in the most affluent groups. So it's obviously a good target, and if we can get everyone to take part, then that should help to reduce inequalities as well. But what evidence do we have that activities in schools that promote physical activity might impact on obesity? Well, the evidence is really quite limited, and that's one of the reasons that we decided to do this evaluation. There have been a number of trials and systematic reviews that have looked at various physical activity interventions, and I think I've just highlighted here 3 that I thought were most relevant. There are several others. But about a year ago in Obesity Reviews, Dr. Love from Cambridge published a meta-analysis, systematic review meta-analysis, looking at the effectiveness of physical activity interventions in schools on objectively measured physical activity levels. So can school-based interventions increase physical activity overall over a full day? And from 25 RCTs and 17 that were included in the meta-analysis, they found that actually there was no evidence that physical activity interventions could have that effect. So if they can't increase physical activity overall, it's unlikely that they would impact on obesity. The Cochrane review on childhood obesity prevention that was updated last year included a subset of studies that looked at physical activity interventions as well. So looking at that primary school age period, 6 to 12-year-olds, they looked at the subset of 14 RCTs that had physical activity interventions and found that there was a reduction in BMI, a small reduction in BMI overall in such trials compared to no intervention. But when they looked at weight status, so standardized BMI, which is a more accurate sort of measure of weight in children, in weight status in children, there was no evidence of physical activity interventions improving BMI Z-score, preventing obesity in children. So a mixed picture, but the same group, a subgroup of the Cochrane Review authors also published a review about 10 years before that, where they did a narrative review of a much wider range of studies. And here they found that physical activity interventions possibly had some effect in girls, but not in boys, although the evidence was not conclusive. So really the prior evidence doesn't support that something like the Daily Mile could be an effective intervention in the plan for reducing obesity. And so we decided that it was important to do an evaluation. So the Birmingham Daily Mile evaluation was a cluster randomised controlled trial, and it was funded by Birmingham City Council for a subset of the region in Birmingham, the South Birmingham region. So this area has a particularly deprived set of families, so it's a more deprived area in Birmingham, and 108 primary schools that served that area were eligible to take part. From those, we selected 40 schools to be part of this evaluation. So the schools that were selected were all taking part. It was an all-school intervention, but we sought consent from pupils in years 3 and 5 to for measurements to be able to evaluate the intervention. Sorry, this is not working. Okay, so children who were in the selected schools and year groups had some baseline measures undertaken, first of all in sort of towards March and April 2017. That included looking at their height and weight, fitness levels, which was done by, so the height and weight were done by researchers, and the health-related quality of life and other questionnaires were administered by researchers, whereas fitness levels and academic attainment were assessed by teachers and reported to the study team. We then randomised after the baseline measures into intervention and control, and then the children were followed up after 4 months, and then again after 12 months of intervention. So we lost a couple of schools along the way, but most schools and pupils were retained, and we were able to do measurements at baseline and these follow-up points. This is just, I'm not going to dwell on this, just to show you some of the baseline characteristics of the people who were in the intervention and control groups. And really the main thing is that the groups were fairly well balanced, so randomization had been successful, and when we had a comparable group at baseline. And this is the main results, so at follow-up. So the first follow-up was at 4 months, and 12 months was the main follow-up, so our main outcome was at 12 months. And what this is showing is that there was a very, very small difference in BMI-Z score in favour of the intervention group at 4 months, which was statistically significant. But at 12 months, the effect size was smaller and the effect was non-significant. So that there could be some small effect, but unlikely, but this effect was not significant by 12 months, which was the main time point for outcome assessment. However, we also had pre-specified analysis by subgroups, particularly looking at boys and girls separately. And here is the results from the subgroup analysis, showing that in girls, there was at 12 months, a BMI-Z score difference of almost 0.01, which is of the size of effect that had been shown in some of the previous the systematic reviews, if there'd been any effect of obesity prevention interventions. Whereas in boys, there was no significant difference in BMI-Z score, and the effect size was actually in the opposite direction, but absolutely not significant. So potentially, and a very small effect in girls, but not in boys. So just looking at some of the other findings, we also did some other measurements, as I'd mentioned. So body fat measures were, the direction effect was similar to that of the main analysis, non-significant, very small differences in favour of the intervention. And this is the TU9D, which is the health-related quality of life measure, which, and this is another wellbeing index measure, both of which showed that there was a favourable effect in terms of the intervention compared to the control, but these differences were not statistically significant. The other data on fitness and academic outcomes, which were teacher measured, were largely missing. This was a very low resource trial where the funding was not of the sort of standards that we do in larger randomized controlled trials. And so we relied very heavily on teachers and others providing data. And unfortunately, I think one of the things that we find is that that doesn't really work. So we had a lot of missing data for the teacher reported measures. But overall, there was no significant difference between groups for any of the outcomes. Sorry, my screen's gone. And although when we looked at the subgroups, again, there was a favourable effect in girls, but not in boys. So in terms of, the TU9D, body fat percentage and MDI, there was a significant effect in the subgroup for girls, but not in boys. So when we looked at cost effectiveness, the cost of the intervention was estimated to be about £48 per child for a year. And there was a small improvement, as I said, in quality adjusted life years, which suggests that the incremental cost effectiveness ratio is around 7,500 per QALY gained, which, using the thresholds that are commonly adopted in the UK, suggests that it was a cost-effective intervention. And if we look at the net benefit of the programme, and using the 20,000 per QALY as a threshold for cost effectiveness, which is the threshold that NICE tends to use, there is a 76% probability that the Daily Mile intervention is cost effective. We also did the cost effectiveness analyses in boys and girls separately, and in girls the cost effectiveness was much more favourable. So the incremental cost effectiveness ratio was £2,500 per QALY, with a 97% probability of it being cost effective, whereas in boys the cost effectiveness was low, with only 12% chance that the intervention was cost effective. So just to conclude, so the Daily Mile is a simple whole school intervention supported by the government. Some schools, I haven't talked about some of the qualitative work that's been done and looking at the process, but we had limited amounts of data on that. But some schools engaged well and delivered the activity as it was meant to be. Others didn't really support it that well, although initially they were quite keen. The enthusiasm did wear off. So overall, in a sort of applied setting, in a trial like this, the Daily Mile has probably a very small, non-significant effect on weight status at 12 months, although it is likely to be cost effective. We found no evidence of any harm on academic outcomes, but the data was limited. And if we look at subgroups, it does seem that, if anything, the intervention is effective and cost effective in girls, but might not be effective in boys. And I think just to finally finish off, I think it's important to remember that schools are complex systems, and when we look at interventions, we should really be looking at how the implementation is in context, rather than just looking at the intervention or the component that's being delivered. And finally, that schools are only one part of that solution in obesity prevention. So if we want to have an effect on obesity, we can't just rely on schools to deliver on that aspect. And finally, I just wanted to acknowledge the wider team who were involved in the evaluation and the funding from Birmingham City Council. Thank you. I'll stop at that, if that's okay. Stop sharing.
Thank you very much indeed, Peymané. That was a really interesting and beautifully timed presentation. Well done. And I think you set us up really nicely in your conclusions there for the two presentations we have to follow, which will talk much more about the experience from the school side of implementing the Daily Mile. So I'm just looking for Michael Harkins to see if you are ready to start sharing your screen, Michael. While you're doing that, if we can be thinking of questions, there's a couple in the chat now. If everyone can be thinking of any questions they'd like to ask any of the speakers, and we'll take those in about 10 minutes time after the next two speakers. So I'm just looking for Michael. Are you ready to start your? Yep, Michael's sharing. So thank you very much.
Is that ready? Hello everyone, my name's Michael. I'm a year 3 teacher at Chandlers Ridge Academy in Nunthorpe, near Middlesbrough. I'm also the PE coordinator at that school, and I have been for the last 3 years. When I took over as PE coordinator, we had just had an all-weather running track built that goes around the perimeter of our school field. It cost £10,000 and funding was from the National Lottery, and the track is guaranteed for 10 years by the company that built it. We've got signposts all around the track that tells the children how far they've run, and when they've done 6 laps of our track, that's 1 mile. In the photos, we've also tried to link the track with little bits of timber trail to make it a bit more fun for particularly children in Key Stage 1, so they can stop off the track and go along the balance beams and things like that to break up their run as they go around the track. This is how it's organised within our school day. So we use break times and lunch times to make sure every pupil in school is accessing the Daily Mile every day. So in the morning break time, we've got Year 1 and Year 6 that share the track. Lunchtime, Year 3 and 4 share the track, and in the afternoon, Year 2 and Year 5. It's supervised by the adults that are on playtime duty for that day, and this timetable is all over school, so the children know exactly when it's their turn to get outside and have a go on the running track. So it kind of runs itself, which I think has been a good thing in terms of keeping it going day in, day out throughout the year. There isn't too much pressure on the teachers to get outside and organise it. It does run itself really well. In the mornings before school as well, as the children start to arrive at the school, we do encourage them to get out and use the running track as well. And I would say on Mondays, Wednesdays and Fridays, probably most of Key Stage 2 will be out doing at least 1 or 2 laps of our running track before they start their school day, which is really nice to see in the mornings. In terms of the benefits that we've noticed in school, I think because every child in the school is accessing it every day of the week, it does reinforce a real positive attitude towards physical exercise in the school. And when I interviewed the pupils to find out about their perceptions of sport and PE that we do in school, they are generally positive about the Daily Mile, and they enjoy their time on the running track. Whether that's walking or running, the children do view it positively. As I've said, it's an all-weather running track, so it's used all year round. Unless it's a wet play time, there are very, very few occasions where the children won't be outside running. So that consistency is really important for us. As I mentioned, a lot of the children will choose to run before school, and it's the parents will sort of hang around on the playground and encourage them to run as well, which is nice and gives you an opportunity to talk to the parents as a member of staff as well. Also, the government target of 2 hours timetable PE per week, we feel is quite hard to achieve within a balanced curriculum, and it ends up squeezing out another subject. So we do have our hour of PE per week, and we make up the other 2 hours of timetabled PE by using our running track in the Daily Mile. So over the course of the week, it adds up to the children's timetable PE of more than 2 hours. And for the school as well, that's important of achieving the school games mark. You need to be doing 2 hours of PE to get a gold level in that, which we currently have. Another government initiative was the Active 30-30. So our 20 minutes per day assists us in working towards that target. Also, since we've started doing it over the last 3 years, I've noticed that our results in the cross-country competitions improved. Each year we've got more children progressing to the later rounds and the Tees Valley rounds of the cross-country competitions. And because the track is shared between Key Stage 1 and Key Stage 2 pupils, it builds some really lovely relationships between them while they're doing their Daily Mile. The Year 6s make sure the Year 1s are running the right way around the track. They don't run off into the middle of the field. and things like that. Some challenges that we've had introducing it. The children are just much more motivated when an adult runs as well. So they are positive about it, but on a day-to-day basis, we've got quite a big mixture of walking, jogging, and running. When an adult joins in as well, all the children will run and have a go. However, to make the daily mile sustainable, I can't ask all of the teachers to go outside and run around the track for 20 minutes a day when they've got a lot of other things to be doing. So in response to that, on a Friday lunchtime, we do a running club, and I use that running club to target children that may be reluctant to engage in other sports or haven't been in a sports team in the school, and that club is a bit more of an effective way of engaging them in the running. Also, I do assembly probably at least once every half term, where just to remind the children of the benefits of the daily exercise, and the idea of personal best is something that we try and embed in our PE curriculum, and something that we remind the children of, so they're able to track how many laps of the track they're doing and aim for their personal best and beating that. And when we very first started it, a small number of parents were a bit unhappy. They were worried about shoes getting muddy, or they didn't really understand the reasons why we introduced that. But after the first few weeks and couple of months, that really settled down. And as I say, it's been 3 years now, and it's just become a part of our school life that we are aiming to continue into the future. All right, thank you.
Thanks very much indeed for that, Michael. That's really interesting. Just giving David a chance to gather himself ready to take over, and there's quite a few questions coming through, so I'm looking forward to the Q&A session in a few minutes. Are you ready, David? I don't think you have any slides to share, do you? Is that right?
I was going to say there's nothing exactly to gather, considering I've got nothing to share.
Gather your thoughts. Are you
I will. Yeah. I'm happy to go. Yeah.
I'll hand over to you then. Thanks, David.
Brilliant. Louise, can I just ask if everyone can see us, or is it something that I've got to do with regards to hitting the video button?
I can't see you at the moment, David. Just let me check.
But you can hear us. Can
hear you fine. Yeah.
I'm not fussed. I've got a horrific haircut at the minute due to COVID, so I'm happy to just hear it. So, it's flashing up saying the host has asked you if you'd like to start your video. Right, try that.
That's it. We can see you now.
Is that better?
Yes, can see you now.
Brilliant. Or is that worse, actually? So my name's David Turnbull. I work for Northumberland County Council's public health team. And I was a part-time student up until last year, and decided to write my master's dissertation thesis on the barriers and facilitators to implementation of the Daily Mile in Northumberland primary schools. So my aim was to basically find out where we had the Daily Mile working, why it worked, and where we didn't, or where it wasn't working as well. What were some of the issues around its implementation? So I used focus groups to support a qualitative data collection approach, and I operated across 3 Northumberland primary schools, 2 of which were local authority maintained schools, and 1 was an academy, so it had independent status, if you like. I had 5 focus groups in total. So 3 pupil-based focus groups, and then 2 which involved teachers, and there was 13 teachers and 26 pupils took part in total. So I think it's probably fair to say that for something like a master's dissertation, it's not a bad return, but it's relatively unlikely to be a holistic view of all 124 Northumberland primary schools that we've got. I used a thematic analysis to try and come up with the barriers and facilitators, but we actually got three overarching themes. There was one of the themes that we just didn't think fitted in with either the barriers or facilitators. And this was the perceived benefits associated with the Daily Mile. So when we were speaking to both children and teachers, there was two overarching themes, if you like, which kept on coming out repetitively. And that was that pupils appeared ready to learn following the Daily Mile. So teachers would often comment that following the Daily Mile, pupils were ready to learn, their learning was enhanced, and the Daily Mile supported children's cognitive function. So that's things like how well they process information, how well they remember information, how well they problem solve, and also make decisions. And also the other one was that the Daily Mile seemed to have cross-cutting curriculum benefits, and I think that was touched upon before. And the use of the Daily Mile and physical activity in its broader sense was not just used in your typical traditional PE or games. It spanned across an array of lessons, science, art, numeracy, where children had designed things like wall charts, counted laps, explored topics such as human growth, and discussed being active for health benefits. Thankfully, within the research, there was some facilitators and there was barriers as well. Otherwise, I would have had to gone back and rejig my title. So I found three main facilitators, and those were that the Daily Mile seems to harvest social relationships between both children and staff. This was probably the most common facilitator associated with the Daily Mile, and it was both peer-to-peer in terms of the social relationship enhancement, but also from pupil to teacher. Children often commented that they enjoyed the time out with their colleagues or with their peers just to relax and have a little bit of downtime. But it was often the case that teachers would comment that in class, due to the time constraints of lessons, they didn't really have the time to get to know and ask questions about the children that they would like to do on a social basis. And the Daily Mile enhanced that and allowed children and teachers to get to know each other a little bit more intimately, if you like. The second facilitator, and again, this has already been mentioned in the opening presentation, was the flexibility of the Daily Mile. And I think that's testament to the Daily Mile's design. Often teachers and students would comment that it would be used at any time of the day. Its lack of rules, regulations, no equipment, low hassle, coats on, get yourselves out, made it a really easy intervention to use with limited impact on the school day. And I think that's really important, bearing in mind that we've already heard that curriculum pressures are probably at an all-time high. And the final facilitator was that outdoor space seemed to create a sense of freedom. So there was quite a lot of children that commented that they tended not to find themselves talking about things in class that they discussed outdoors during the Daily Mile. And that being outdoor, maybe that was the green space, maybe it was the wide open space, gave them a little bit of confidence in just discussing slightly more personal issues than what they necessarily would inside the school buildings. And again, I think when we've already heard about things like well-being, it's really important to take that into consideration. So two barriers, and again, as I mentioned before, competition from an already busy curriculum. Teachers would often comment that the academic curriculum was already crammed, and the previous chap who was a PE teacher mentioned this. It was very, very difficult to get in PE curriculum time, never mind fit in an additional 15 minutes. So I think there's something there around just being mindful in terms of what's actually being taught in the curriculum, and how well, when designing future interventions, that they can just slot into the curriculum. And also the final barrier was that non-participation of teaching staff seemed to filter down into children. This was both an observation prior to conducting my research, but it was also one of the most common issues that children brought up when they were doing the Daily Mile. And children would often comment that the level of participation of either the teacher or the teaching assistant would filter down into them, i.e. if the teachers put their running trainers on and went out with them, then they would follow suit. If teachers didn't and just stood in the middle of the concrete yard or the school playing field, that the children felt less likely to participate or maybe not run or walk as far than what they necessarily would. So I think just in terms of rounding things off, and some of these things have already been mentioned, I think interventions to try and increase physical activity levels of children within school, to try and deliver the 30 minutes of physical activity that schools are trying to deliver, should obviously be welcomed, but I would put a caveat on that in saying that it's vitally important that we include the children's or the child's voice when we're designing these interventions. I think there's a range of key stakeholders. Teachers and children are just two of those key stakeholders. I actually looked to set out to include the voice of parents as well, but just couldn't recruit any parents into the study. And we did things like playground talks to the kids, and we also went out at collection, so drop-off and collection time, to try and engage parents, and sent letters home, and couldn't get any parents to participate in the study. And also, I think what is two more things. What's really important is that we know that enjoyment and fun drive children towards being active, and I think they've got to be critical parts in any future interventions that we design. And one final thing I would say, which wasn't enough to get its own theme, if you like, within my research, but there was anecdotes that being physically active at school was the only opportunity that some children got to be active, so they were pretty much sedentary once they left the school gates. And I think that's critically important. So if we're going to design 15-30 minute interventions, we've got to make sure that they're enjoyable, the work, because it's a real captive audience with children. If they're going home and doing nothing, it's even more important. Happy to take any questions.
That's great. Thank you very much indeed for that, David.